No new parent wants to think their baby will ever need a neonatal intensive care unit, but a Salinas couple is grateful the Level 3 NICU at Salinas Valley Memorial was available when they needed it. Baby Archer is now thriving, and he's had a lot of people cheering him on, from the hospital staff to high school students. From the beginning, Chelsea and Nicholas Sterrett knew one thing.
We've always talked about being parents and having a family.
So when the couple got pregnant, they were overjoyed.
Just put the pregnancy test down on the table right in front of him, and then he looked at it and looked up at me and gave me the biggest hug. And he said, "I didn't think I could love you any more than I already did."
Everything seemed to be going to plan.
The 8 months leading up to Archer's birth were wonderful. Chelsea's pregnancy was fairly normal. She was happy.
I didn't have any morning sickness, and I was eating really healthy. All the checkups that we had too, and ultrasounds, everything was looking great. He was right on track.
But at 8 months, Chelsea went into labor.
She started feeling some pain in her stomach.
I didn't know for sure if it was contractions. We were actually supposed to start childbirth classes 2 days later.
Doctors confirmed the pains as contractions, and after 27 hours of labor, Chelsea gave birth to little Archer.
The specialists were on hand, right there, ready in case there was an issue.
Most people think when we talk about preterm infant, we're thinking about those 1-pound babies that unfortunately require a lot of support. But in reality, Archer is the more common type of preterm baby that we would normally see in an intensive care unit. When babies are born at that gestational age, they're at risk for a number of problems that we should not just consider them as being a term infant. They could run risk, for example, of not maintaining their temperature. They can run risk of having low blood sugar, of getting very jaundiced, and more commonly they have a lot of problems with feedings.
There was a lot of anxiety. Again, it was just not knowing. I actually went with Archer right away and watched him go through a battery of tests for various things. During the hospital tour, they were pointing out the NICU and telling us all these things about it that it never crossed our minds really that he would have to go there.
Turns out we needed it, and I'm just so grateful that it was there for us. Right after he was born, there were nurses from the NICU and a respiration specialist right there in the room, and then they were able to take him right down the hall when it was time for him to go, and he didn't have to have any extra trauma of being transported or not getting the things he needed right away. When I came in, he had a breathing tube in his nose, he had an IV in his leg, and he was hooked up to all these different monitors.
He required support for the first several days of life, which included intravenous fluids, and then we had to basically show Archer how to feed.
They told me that I would be able to board at the hospital and be on the same floor. And when they first told me about the option, Nick and I were talking to each other like, oh, well, we'll have to see if our insurance covers it. And they're like, oh no, it's just courtesy for families with the babies there.
I'm glad to be a part of Archer as one of the team providing care to Archer, because from the first hours of life that Archer was born, I see the difference of Archer growing and improving.
Baby Archer became an instant star at Palma High School, where Nick is a teacher. Students and teachers rallied behind a Miracle Genes Day in Archer's honor to raise money for Children's Miracle Network, which helps fund the NICU at Salinas Valley Memorial.
It was incredible, very grateful. It was, for as stressful as an experience as it was, I really couldn't have asked for anything better than that, of feeling like they were all there to help me and to help Archer. Archer's doing so well. He's just happy and healthy and big.